The last 2 years have been truly just going and nonstop.
You'd go through one wave and then we'd have Delta and then a heat dome hit and then we had fires and then floods are the next and in plain sight report plus the opioid crisis ongoing. It just seemed to go on and on.
Thank you. Thank you for coming in and showing up and doing what we're here to do.
The frontline workers, cooks that cook, we thank you.
I'm not the only one who has mental health effects from working in a pandemic.
We can all say that we're definitely, had our fill.
This isn't the happy place of work that it used to be.
How much can we handle?
And I burst into tears. I thought, what am I doing to myself?
We've had our entire team run into the ground.
In the end, it's almost like it's not worth it.
I don't know if we're going to be okay.
I think our system is struggling.
I'm worried about the next 3 years more than I was worried about the last 2.
We are facing a psychological health and safety emergency in our system.
This is a real threat to us, right? And to society. We need our healthcare professionals.
We can no longer do things the way they've always been done.
Because we're not going to treat our way out of this problem. We're going to have to reform our way out of this.
You can have a new building, you can have new equipment, but if the people there aren't engaged and aren't supported to give great care, then that's going to impact the quality of care.
I think that duty to care comes at our own expense.
When you're not taking care of yourself, how are you going to take care of others?
You can't help the sheer number of people you could have if you did take the time to take care of yourself.
Please don't give it all away. Remember to save something for yourself. What do you need? What do you need so that you can keep going?
We need to change healthcare such that we can listen and that we don't have to stand and say, it's fine, I'm okay, I'm going to continue on.
We need to be asking that to the healthcare providers. What matters to you? And how do we build the right environment again for them to work? Because if we don't address that, people will continue to leave, and then we won't have enough providers to care for the patients.
Because that's all they want to do. That's all the 330,000 healthcare workers across this province want to do. They want to come to work and do their best work, the work they were trained for, that they're excellent at. And we have a responsibility to create spaces where they can do that.